National Grief Awareness Day is August 30th. On August 30th, National Grief Awareness Day recognizes the time it takes to heal from loss doesn't have a prescribed course, and as a reminder, closure comes in many forms. When a loved one dies, the void they leave affects everyone differently. Joining us today is Dr. Richard Leggett, a core faculty member of the General Psychiatry Residency Training Program at the Lewis-Gale Medical Center in Salem, Virginia. Dr. Leggett also serves as vice chairman of the SMA Education Committee.
Hello, Randy.
Hey, how are you?
Okay.
Good. Good to have you today. Provide some context to our audience on the mental health impact that grief plays on our system.
Certainly, grief is one of the common elements of humankind, and dealing with grief is something that each individual culture tends to develop their own ways. There's some kind of classical literature about how people go through grief, but the important thing to remember is that there's not uh, a specific one way, that each person has to grieve in their own way. And one of the nice things about the August 30th Grief Awareness Day is that it reminds us that we need to be mindful of those that are going through grief at a given time and provide support for them, but also to remember that in stages where we're going through grief, we need that support as well, and we need to take care of ourselves.
Oh, absolutely. And I would imagine that, it's a long game as well. Because some of these instances of grief may last a lifetime, even in some cases, in the amount of stress and strain on the body. So, what are some signs that someone might be struggling with grief, and how can people sort of intervene?
Well, the kind of classic description of the different stages of grief is one way to start. But the important thing, again, is to remember that these aren't one after another, but they help you to kind of identify stages. The first one is usually shock or denial. And at that stage, people just, they don't know what to do. They're just kind of, looking dazed. And that can last anywhere from a few days to even weeks. But eventually it goes into another type of emotion, and that's often kind of a sense of bargaining, of trying to figure out what could I've done to prevent this, or how could I have gotten by or use that time more wisely. And then often there's a period of depression. I'm just feeling hopeless about, oh, I've lost this person, then I may have lost other things, and the other ramifications kind of go along with that. But one of the emotions that comes out at some point generally is anger, and that's probably the most difficult to deal with. And I think that a good reminder there is to remember that anger is a part of processing those emotions, and it's not directed personally at the person who's trying to help. But a lot of times we tend to shy away from people that are angry. But if they can express that anger in a non-destructive way and work through that, then eventually most people get to a level of acceptance, realizing that they treasure the memories that they have of that person that they've lost, and they are able to carry that with them. But they're able to move ahead and realize that that's what's best for them.
That that is a huge pearl of wisdom there for me, is because I think generally when people are faced with anger, they respond in anger or they withdraw. And what you're saying is that it's basically a cry for help. And trying to understand what's behind that could go a long way and help people deal with the core problems.
That's right, Randy. So
Um,
there are,
yeah, go ahead.
I was just going to say that there are a number of ways that we can celebrate or observe the National Grief Awareness Day. First, just being aware of grief, but also looking for those friends that are going through a grieving process. It may be family members, it may be people that we work with, but being sensitive to them, and just letting them know that you're available, that you care, that you can even offer to do certain things that would take a little bit of load or stress off of them. But like I said before, in addition to being aware of others grieving, recognize your own grieving. That most of us at some point are going through that process, and sometimes it's grieving multiple different things in different ways. And make sure that we have the downtime and look at wellness activities that allow us to keep from overstressing ourselves. And it's been said that you can't help other people until you help yourself. And the classic, I guess, illustration of that is when you get on an airplane and they tell you, if the oxygen mask come down, you put yours on first, then you help the person next to you. And I think that dealing with grief can be that way, because if someone is all tied up, they're trying to help others, but they really aren't helping themselves, then that's very difficult.
Well, without
Another
yeah, go ahead further.
Another way that just getting the word out and helping people recognize that grieving is a natural part of life. It's something that we go through at different levels, different times in our lives, but helping to educate people. And there are a number of, I would say, myths about grieving that sometimes it's good to consider the fact that people may have misinformation about grief. And some of the things that people might think are really the causes of grief may be just the kind of the surface explanation, and what they're really grieving is something a lot deeper than that.
Yeah, I think that without oversimplifying, but trying to provide some practical advice, really being good listeners with the people in our lives. If, taking the time, I know with, the way our culture is that we get busy and we're moving from one thing to the next, and we can sometimes not give just people our time and attention. And how, big of an impact would it simply be if everyone really just took the time to kind of engage and listen and maybe try to help people go deeper on some of these things. Yeah.
Another myth that kind of goes along with that is again the idea that you can have a specific time and that it was one size fits all, because grief is a process that each person has to work through on their own time frame. And we can be supportive and allow them to go through those stages, even the difficult ones like the anger stage. But to recognize that it may take, like you said before, months, years, even a lifetime to go through the grieving process.
What are some good resources out there that people might that either dealing with grief themselves or have a family member, someone who might be going through an extra, difficult time?
There are a number of grief support groups. A lot of community mental health boards have those groups. A lot of churches have groups that just basically allow people to continue that process and at the pace that they can handle. There are national hotlines, and there are other support available. Just using the platform of the National Grief Awareness is one opportunity to get plugged into realizing that there's other things that can be helpful there.
Yeah. So that sounds like a good takeaway on August 30th. Just take that next step in trying to identify and help raise awareness that this is a real thing that we all go through. No one's exempt from it, and looking for ways that we can just really help deal with this issue. So anything you'd like to close with on this issue?
I guess just from the fact that I'm not sure exactly how the August 30th date got picked, but when I thought about that, it reminded me of my own grief over my mom died on the 31st of August. And that was a number of years ago, but I feel like I'm still, remembering that and enjoying the positive things about knowing her. I still have a number of her plants. She was a big plant enthusiast, and I've been able to maintain some of those for now going on 20 years. And it's a good connection with her, but to realize that you can lose something, but you retain something as well.
That's beautiful. Well, thank you very much for bringing this to light to our listeners, and just everyone take time to reach out to someone on August 30th, or at least take the time to acknowledge the grief that you may be dealing with in your own life. Thank you.
Thank you.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.